Have you ever seen anyone on TV where one of their eyes is half open or their brows are spocked and wondered to know what happened? Was it a stroke or was it just bad Botox? So for the next little bit, I'm going to be explaining to you the pros and cons of Botox, what you need to look for to ensure that you're going to have a natural, youthful injection, and also if you're even a candidate for this. You may be asking yourself, what is a neurotoxin? A neurotoxin actually relaxes muscles, softens fine lines and wrinkles. So from this point forward, when we talk about neurotoxins, I'm going to use the term Botox. But neurotoxins are actually include Botox, Dysport, Xeomin, Lativo, Jeuveau, and Daxxify. All of these work the same. They're just made by different companies. So the art to doing Botox to where you look natural, more youthful, more rested is to make sure that you don't freeze those muscles. You want them to actually move, but you want them to also smooth out those fine lines and wrinkles and giving you more of a youthful appearance. So when is a good time to start getting Botox? It's not really an age. Obviously, we want you to be an adult or over 18. We don't want you to be pregnant or breastfeeding at that time. But a good time is when you start to notice that you're having more resting lines or starting to get those fine lines and wrinkles around your eyes like the crow's feet. And in that scenario, it's a good time to do the Botox because it helps to relax those muscles and you get a more youthful appearance. So what are the most common areas for Botox treatments? The 11s or this glabella region, the area between your brows, your crow's feet, or your fine lines as you smile, your forehead lines. And this is a really important point. A lot of people come in and they'll be like, I just want my forehead lines to be Botox. I don't want Botox anywhere else. Well, what's going to happen? The Botox actually relaxes the muscles. So if we just do your forehead, which is your only muscle, your frontalis muscle in your forehead is your only muscle that actually raises your brows. So if we just do that, then we're relaxing this muscle. Well, the frontalis muscle attaches to your muscles around your eyes or between your brows, and that actually pulls that frontalis muscle down. So if we're just relaxing the only part of your brow that lifts, and we're allowing these muscles here and here to pull down, you're going to have a dropped or a heavy forehead or feel like your eyes just won't open. That's not the result you want. Actually, you have to look at the muscle, the strength of that muscle, and what that muscle does when it moves in order to get a natural, more youthful, appropriate result. Also, sometimes people come in with platysmal bands. When you see these bands in the neck, which I haven't injected mine for a while, so it's these lines in here. If you get those, we can actually relax that. That'll also help you to get a more elongated neckline without these lines in this region and give you a more sharper jawline. The other areas that we can treat for Botox that's become somewhat talked about more recently is to actually do the Barbie necks or the trap tops. Actually, what happens is it relaxes the trapezius muscle, giving you more of an elongated neck. Those are areas you want to be cautious about and make sure you have a educated, experienced injector injecting those areas. There's an art to injecting Botox. You want to determine the units that are necessary to achieve the results that you're looking for. It is true that dose does equal duration, but there's a fine line there where you want to make sure that you use the right dose so that you get a result that's going to last about 3 to 4 months. But you don't want to have a frozen result. The other thing people are concerned about is, what if I don't want to continue Botox? Is that going to make me look different, or is it going to cause any permanent damage? No. Fortunately and unfortunately, any kind of neurotoxin like Botox lasts somewhere between 3 to 6 months, depending on the one you're using. There is no long-term damage from a Botox injection. You will always go back to the results that you had prior. A lot of people that want to keep that result, and over time, that does help to relax the muscles and it helps to decrease the strength of those muscles, producing a more rested version of you between treatments. Botox isn't something you can negotiate units with your injector. Certainly everyone has a budget that they need to work with, and that's not a problem, but you need to make sure that you're treating one area to completion, or that you're not treating one area and it's going to cause a worse effect. The number of units are specific for the results that are desired. We usually wait about 2 weeks to get the full effect of the Botox. Sometimes people might feel like their tox is uneven, and it's because it kicks in different muscular, different areas at different times. Starts working about 2 to 3 days in, get most of your results between 5 and about 9 days, and then 9 or 10 to 14 is when you get your final results. So you never want to be touched up too soon. If you feel like that you have a spot brow or something, 2 weeks before you come in and treat that. Otherwise, if you came in too soon, you could cause heaviness and it could affect the whole result. The second thing that you want to do is after you get your treatment, we tell you not to overheat. So don't go out and do yoga, no exercise. You can walk and do your normal activities. We have you just be gentle when you wash your face that night. We don't want you to see how much you can rub the areas we've treated because you don't want to move that Botox. It would be difficult to do, but you want to get it absorbed in the proper muscles, get the proper result. The other thing is drinking alcohol. That can sometimes cause more swelling and also cause Botox migration in the first 24 hours. Beyond that, you can put makeup on, you can wash your face, just do it gently, go back to using your original skincare, and those restrictions would be for about 24 hours. So what about baby Botox? Baby Botox is actually really kind of a false way to advertise. You either have a result from Botox or you don't. And there's a proper dose to get the results that you're looking for. If you just do baby Botox or do baby Botox more often, so I have a more natural result, the truth is you can actually develop resistance to Botox because when you inject people in a period of time sooner than every 3 months, you increase their likelihood of them developing antibodies against one of the inactive proteins on these toxins. So it's not recommended to inject more regularly than every 3 months. In addition, you want to do all of your Botox injections at that one time instead of just staggering them where you only do the crow's feet this month and then the glabella next month. That's not a good way to do it because over time, your risk greatly increases for developing resistance to Botox due to the fact you develop antibodies to Botox. That being said, you want to make sure that you're doing your Botox injections no sooner than every 3 months on a regular basis. The exception to that would be the first time you come into a medical spa. Oftentimes the injectors, if they're experienced, are going to be good at guessing what your dose is going to be, but you always want to hedge on the side of injecting a lower dose if you're not sure, and you can always add units later. But there's no way to reverse Botox quickly. If you do have a result that you're not pleased with, it's not permanent. It is going to go away, but it'll usually take 2 to 3 months. Another common question we get is sometimes people feel like that they actually get headaches after they get their Botox. And that's typically from someone injecting too deep in the muscle. Skilled injector will not inject that deep, so you should have much better results. There is an art to the depth of the Botox to get the desired results. There are some places that you're going to inject deeper than others, but that's all part of the art of injections. Neurotoxins work by relaxing the muscles. That helps to relieve the fine lines and wrinkles, actually allows you to continue to move your muscles so you have your normal expressions. You don't look different, you just look more youthful, rested, and relaxed.